Hello, welcome to CUNY SBS Nursing Programs. Complete your MS in Nursing online. I am Pat Bartley Daniele. I am a doctorally prepared family nurse practitioner with expertise in critical care. And I am an associate nursing professor and the graduate education program advisor for SBS CUNY. I also am the co-chair for the SPS nursing program mentoring initiative. So why earn a master's degree? Well, one, to enhance your professional knowledge, two, develop leadership skills, and three, enhance employment opportunities. I would certainly say that all of you who have completed a pre-licensure program and have sat for the NCLEX know that you were prepared as a generalist. But in terms of the master's program, you are prepared as a specialist. Next slide. So why choose SPS nursing programs? Well, we're fully accredited by the Collegiate Commission on Nursing Ed, better known as CCNE. We do have affordable tuition at the graduate level. It's $470 per credit part-time and $5,545 full-time. And the non-residents, it's $565 per credit. They also provide unique opportunities in terms of being on an online environment with your peers. There is clinical placement assistance, since all master's programs in nursing finish with a nursing practicum, which requires a clinical component of 135 hours. We have fall and spring admissions, and we have a wide array of excellent support services for the students at SPS. In terms of advisement, the writing fellows, quantitative fellows. We also have a psychologist on board in terms of mental health. So there's a lot there that we offer. We are connected to the students, even though it is an online environment. Next slide. So what are the programs in the MS in nursing programs? The three programs in CUNY School of Professional Studies are an MS in Nursing Ed, an MS in Nursing Informatics, and MS in Nursing Organizational Leadership. Be aware that if any of you are on the line, we also have these degrees as an advanced certificate option, which basically means you have a master's already in one area and you want to get an additional specialization. And we'll go over that in the next few slides. And we also have a dual degree program, which are associate degree nurses who apply for the program and go from when they apply, they have made the decision to go straight through to the master's. So you combine both your bachelor's and master's. That degree is awarded upon completion of your MS degree. And in addition to that, you are able to save 15 credits in terms of the total amount of credits for the degree, because some of the courses that you would take will be at the master's level, and that will satisfy the baccalaureate level course. Next slide. So who are our students? Well, they're like you, working adults, many in career transition, people with families, and people who need and want a degree that fits their own schedule. Certainly online learning has really facilitated that. I would just say, important for you to realize that the majority of our students work full-time and go to school part-time and have multiple responsibilities, and yet are able to do well and complete the program. Next slide. Our admission criteria is a BS in nursing. Of course, that would be different if you applied for the bachelor's to master's dual degree. You need a 3.0 or better. You need an unencumbered RN license and registration, an admission essay, 2 letters of recommendations. One must be from a nursing faculty or nurse educator, and one from a nurse supervisor or a nurse manager, a scholarly project, which we'll go over in a minute, and a resume. Next slide. So what is the scholarly work guidelines? Well, often the students will use their capstone or evidence-based project from their baccalaureate program. But we do have a wide array of students who are in the clinical setting and have not been in school for a while. So they are able to describe as their scholarly work a quality improvement initiative at the facility. Examples have been implementation of an updated fall prevention policy, a pain management policy or a restraint policy, or if you took place in a research study, or a practice improvement initiative. In that situation, you would write a 2-page summary about a maximum of 1,000 words, excluding the title and reference, with and label it evidence-based practice project, quality improvement project, research project, or practice improvement project. How did you participate in the project? You would describe that in the 2-page summary and describe the rationale for the project and support it with evidence behind the implementations of this practice change. Please make sure that you cite references that are evidence-based practice references and follow APA format. Next slide. So let's talk about the breakdown. No matter what you're exploring in terms of listening to this webinar, all students complete 45 credits. There are 27 credits of core courses. There are 4 specialty courses in the specialty you choose, and that includes the nursing practicum of 135 hours and 1 graduate elective. So for the MS, which I said is 45 credits, there are 9 core courses, which are 27, right? 9 times 3. And there you will be with students from all the specialties: informatics, education, and leadership. Once you complete those core requirements, you will then enter the specialty courses. There are 3 courses to prepare you for the practicum that are 3 credits each. And you then, excuse me, have the foundation to have the nursing practicum. There are a lot of requirements for the practicum. We do provide assistance, but it will be in the specialty that you choose. If there's anybody here that has a master's already, the advanced certificate would be 18 credits. It's a postmaster certificate, which would include the 4 specialty courses with the practicum and 1 graduate elective. This is the link for the deadlines, but I can tell you for the spring, April 6th is the deadline for the applications for the fall of 2023. Next slide. So the MS in nursing education focuses on curriculum development, educational strategies, testing and measurement, accreditation in terms of program accreditation, and preparation of a future RN workforce. I would definitely say to you that 2 major concentrations in nursing ed will be a clinical nurse educator who works in a clinical setting, whether an ambulatory care setting, hospital, or an academic nurse educator, similar to what I am in terms of working in a university. Graduates are qualified to serve as educators in college, major universities, academic health centers, and community-based health facilities. And it does provide the foundation for you to continue doctoral study in education. And once you have received, once you have gained experience as a nurse educator, you can also sit for the certification in terms of the nurse educator exam. Next slide. Nursing, MS in Nursing Informatics. This is definitely an area that is exploding. It includes data analysis and application, technology optimization and design, data management to enhance quality and safety in care delivery. And the roles that they have in terms of preparing are clinical informatics specialist, informatics nurse specialist, clinical applications coordinator, and they also are potentially able with clinical, with clinical hours in terms of work hours, able to sit for the ANCC certification exam. I certainly know that many of you have experience with Epic and the electronic record. So that would be a good example of how do you build those documentation systems, not just to assess the patient, but also to measure outcomes and also to measure workflow. Next slide. Nursing organizational leadership focuses on nursing, on leadership skill development, interprofessional collaboration, financial and system analysis, and policy analysis. Graduates are qualified to serve as directors of nursing, chief medical officers, nurse managers, accountable care coordinators, and wellness program directors. So there's a wide range of opportunities in nursing leadership. And also remember that these roles are a combination and a reflection of what you do both clinically and academically. Next slide. So, are you ready for online learning? Well, just a few basic questions you need to look at for online readiness. I have access to a computer with a high-speed internet connection. I am comfortable with installing and troubleshooting software on my computer. I am proficient with using search engines and advanced search options, and I will be able to devote 10 to 12 hours per week to dedicate to each of my courses. So each 3-credit graduate course requires 10 to 12 hours per week in terms of discussion board, assignments, and papers. So it is a commitment. Next slide. So what is it like to learn online? There's a YouTube here, but I would suggest that I'm not going to show it because it really is for students who have already decided to come to the program, but I will explain some of the language attached to it. One, it is asynchronous. So you will see that in many online programs, it will say synchronous or asynchronous. Asynchronous means that the week's learning activities open on a day and then close on the end of the week. You can log in at any time during that week, participate in the course based on the deadlines, and submit your papers and assignments via Blackboard during that week. You physically do not have to be present at any designated time per week to meet with the faculty. That does not mean that we are not available. The faculty are very close and reach out to the students and have had Zoom sessions and had all sorts of strategies to support the student through their coursework. They are small classes, usually about 15 to 20. In some ways, there's a lot of engagement because you do have to post in the discussion board and answer the questions. And you also have to respond to your classmates. So you can see that you are actively participating in your learning every week. I will just say in general, there's always a few exceptions, especially related to school holidays. But in nursing, the week's activities open up on a Monday. The students have to post on a Thursday by midnight, and they have to respond to their classmates by Sunday. We ask the students to log in at least 3 to 4 times a week, because there's also announcements, and it may also be feedback on your assignments, but you see that you are engaged. As we mentioned before, you need to dedicate about 10 to 12 hours per week on the course, and also have a computer with high-speed internet access. Next slide. Here is an example of what opportunities we have in terms of looking at the virtual environment. Some of you may have had this already, but Shadow Health is used in advanced pharmacology and advanced pathophysiology, and you have virtual simulations that are part of your weekly assignments, where you're actually able to assess lung sounds, do a physical exam, talk to the patient via chat, and formulate a plan of care. And it has been very well received by the students, and it also has been acknowledged by CCNE as an innovative learning strategy that is virtual. Next slide. So the student services, you have a dedicated faculty advisor. As I mentioned, I'm the nursing ed program coordinator. Dr. Paradiso is the nursing organizational leadership advisor, and Dr. Lily Matthews is the nursing informatics advisor. You meet with your advisors every semester to plot out your, I say the plan of care, but your academic plan. We have an excellent library. Newman Library is our library, and all courses have a direct link into the Baruch Library, so you can do your online searches. We have a help desk for tech support that you can email if you have any issues in terms of password or access. Tutoring, we have the most common ones are the writing fellow and the quantitative, which is usually the statistics fellows. They, because of COVID, have really dramatically increased their online services. So you have both the advantage of online and on campus. We have a whole career services department that can assist you with resume writing, job searching, interview skills. And we do have free mental health counseling with a psychologist to support the students in terms of whatever mental health needs they may have. Next slide. So it went so fast. I thank you for your time, and I appreciate you attending the webinar.